Unlocking the Mysteries, a guide to the female reproductive system. Welcome back to our channel. In today's video, we will dive into an essential topic. Whether you're looking to understand more about your body or simply curious, this guide will cover everything from anatomy and functions to common health concerns. Let's get started. Segment 1. Overview of the female reproductive system. The female reproductive system is a complex network of organs and hormones that plays a crucial role in reproduction, menstruation, and overall health. It consists of external and internal structures. 1. Ovaries. These are the female gonads that produce eggs, ova, and hormones such as estrogen and progesterone. Ovaries. 2. Almond-shaped organs that produce eggs, ova, and hormones like estrogen and progesterone. The ovaries are vital components of the female reproductive system, primarily responsible for the production of eggs, ova, and hormones. Anatomy of the ovaries. Here's an overview of their anatomy, functions, and significance. Structure. The ovaries are two small, almond-shaped organs located on either side of the uterus in the pelvic cavity. Size. Each ovary typically measures about 1.5 to 3 inches long in adults but can vary depending on a woman's age and reproductive history. Parts. Hilum, the area where blood vessels and nerves enter and exit. Cortex, the outer layer containing ovarian follicles at various stages of development. Medulla, the inner layer composed mainly of connective tissue with blood vessels. Functions of the ovaries. Oogenesis, egg production. Ovaries produce eggs through a process called oogenesis. Females are born with all their eggs. This number decreases over time. Each menstrual cycle typically involves the maturation of several follicles, but usually only one becomes a dominant follicle that releases an egg during ovulation. Functions of the uterus. 1. Menstruation. Each month, if pregnancy does not occur after ovulation, hormone levels drop leading to shedding of the endometrial lining. This process is known as menstruation. 2. Pregnancy development. If fertilization occurs, the embryo implants itself into the endometrium where it grows throughout pregnancy until birth. 3. Contraction during labor. During childbirth, contractions from myometrial muscles help push the baby through the cervix and out through the vagina. Importance of uterine health. Regular checkups, routine gynecological exams can help detect issues like fibroids or endometriosis early on. Awareness, understanding symptoms such as abnormal bleeding or severe pain can be crucial for timely medical intervention. Common concerns. Some common issues related to uterine health include uterine fibroids, benign growths that can cause heavy bleeding or discomfort. Endometriosis, a condition where tissue similar to endometrial tissue grows outside, should be managed by healthcare professionals due to painful symptoms. Uterine prolapse, occurs when pelvic floor muscles weaken, allowing part or all of your uterus to slip down into your vagina. This may require treatment depending on severity levels. 2. Fallopian tubes. Fallopian tubes. These tubes transport eggs from the ovaries to the uterus. Fertilization usually occurs here. The fallopian tubes are essential structures in the female reproductive system that play a crucial role in fertilization and early pregnancy. Here's an overview of their anatomy, functions, and significance. Anatomy of the fallopian tubes. Structure. The fallopian tubes are two slender tubes, each about 4 to 5 inches long. They extend from the ovaries to the uterus. Location. Each tube is located on either side of the uterus, connecting the ovaries to the uterine cavity. Parts of fallopian tubes. Infundibulum, the funnel-shaped opening near the ovary that catches released eggs. Ampulla, the widest section where fertilization typically occurs. Isthmus, a narrow portion connecting to the uterus. Interstitial part, the segment that passes through the uterine wall. Functions of fallopian tubes. 1. Fertilization. After ovulation, when an egg is released from an ovary, it enters the infundibulum and travels through the ampulla. Sperm can meet and fertilize an egg within this section during its journey through the tube. 2. Transportation. Once fertilized, or if unfertilized, eggs move through cilia-lined fallopian tubes toward the uterus for implantation or eventual menstruation. 3. Support for early development. If fertilization occurs, early cell division happens as it travels down towards the uterus before implanting into its lining. Importance of fallopian tube health. Maintaining healthy fallopian tubes is crucial for fertility. Blockages or damage. Conditions such as pelvic inflammatory disease, PID, endometriosis, or previous surgeries can lead to blockages in fallopian tubes affecting fertility by preventing sperm from reaching eggs or hindering embryo transport to uterine cavity. Ectopic pregnancy risk. If a fertilized egg implants outside of this normal site, often within one of these tubes, it leads to ectopic pregnancy. This condition can threaten maternal health and requires medical intervention. Common concerns. Some common issues related to fallopian tube health include pelvic inflammatory disease, PID, an infection that can cause inflammation leading potentially resulting in scarring which may obstruct tubal function. Endometriosis. A condition characterized by endometrial tissue growing outside lining. It may also affect surrounding organs including fallopians, resulting in pain and infertility challenges if untreated. Ectopic pregnancy. As mentioned earlier, it's when a fertilized egg implants outside its usual location inside fellow areas like F-tubes, instead leading serious complications requiring immediate treatment. 3. Uterus. Understanding the uterus. The uterus, often referred to as the womb, is a crucial organ in the female reproductive system. It plays a vital role in menstruation, pregnancy, and childbirth. Understanding its structure and functions helps us recognize when something isn't right. Common uterus diseases. There are several diseases and conditions that can affect the uterus. Let's go over a few of the most common ones. 1. Uterine fibroids. These are non-cancerous growths in the uterus that can cause heavy bleeding, pain, and pressure symptoms. 2. Endometriosis. A condition where tissue similar to endometrial tissue grows outside should be managed by healthcare professionals due to painful symptoms. 3. Uterine prolapse. Occurs when pelvic floor muscles weaken, allowing part or all of your uterus to slip down into your vagina. This may require treatment depending on severity levels. 4. Uterine cancer. A more serious condition that requires immediate medical attention. Symptoms may include abnormal bleeding and pelvic pain. Symptoms to watch for. Recognizing symptoms early can be key. Common signs include irregular or heavy periods, chronic pelvic pain during intercourse, abnormal vaginal discharge. If you experience any of these symptoms, it's vital to consult a healthcare professional. Medicinal plants for uterus health. Now, let's explore the world of medicinal plants. Nature offers a plethora of options that have been used traditionally to support uterine health. 1. Red clover, Trifolium protens. Known for its high content of phytoestrogens, red clover can help alleviate menstrual symptoms and promote hormonal balance. 2. Chaste tree, Vitex onus castus. Often used to treat menstrual disorders, it helps regulate hormonal levels, making it beneficial for conditions like PMDD, premenstrual dysphoric disorder. 3. Donkey, Angelica sinensis. Known as the female ginseng, it is used in traditional Chinese medicine to address menstrual irregularities and improve overall reproductive health. 4. turmeric, curcuma longa. Its anti-inflammatory properties can help reduce symptoms associated with endometriosis and other uterine disorders. 5. Ginger, Zingiber officinale, frequently used to ease menstrual cramps and discomfort. Ginger can be consumed as tea or in capsules. 4. Cervix. Cervix, the lower portion of the uterus that opens into the vagina. It provides a passage for menstrual fluid to exit and for sperm to enter. 5. Vagina. The vagina is a vital part of the female reproductive system, serving multiple functions throughout a woman's life. Let's break down its anatomy, function, and significance. Anatomy of the vagina. External structures. These include the vulva, which encompasses the labia majora and minora, clitoris, urethral opening, and vaginal opening. Internal structures. The key components here are: vagina, the canal that connects the external genitals to the uterus. Functions of the vagina. 1. Birth canal. During childbirth, the vagina expands to allow for the passage of the baby from the uterus to outside the body. Functions of the vagina. 2. Menstrual flow passage. The vagina serves as a channel through which menstrual blood exits during menstruation. Functions of the vagina. 3. Sexual intercourse. It acts as an entry point for sperm during sexual activity. It also accommodates penetration. Functions of the vagina. 4. Self-cleaning organ. The vagina maintains its health through natural secretions that help to balance pH levels and prevent infections. Importance of vaginal health. Maintaining vaginal health is crucial for overall well-being. Hygiene practices. Regular cleaning with mild soap externally is important, but avoid douching or using harsh chemicals inside as they can disrupt normal flora. Regular checkups. Routine gynecological exams are essential for early detection of issues like infections or abnormalities. Safe sex practices. Using protection during sexual intercourse helps prevent sexually transmitted infections, STIs, which can affect vaginal health. Common concerns. Some common issues related to vaginal health include infections. Yeast infections or bacterial vaginosis can lead to discomfort, itching, or unusual discharge. Menopause effects. Reduced estrogen levels may cause dryness or thinning of vaginal walls post-menopause. This can be managed through various treatments available today. 6. Vulva. The external female genitalia, which includes structures such as the labia, folds of skin, clitoris, and the opening of the vagina. Structures. External structures. These include the vulva, which encompasses the labia majora and minora, clitoris, urethral opening, and vaginal opening. Internal structures. The key components here are: vagina, the canal that connects the external genitals to the uterus. 7. Breasts. While not part of the reproductive system, breasts are significant in females for the production of milk during lactation and have a role in sexual arousal. Breasts are complex structures that have both reproductive and aesthetic functions. Here's a deeper look into their anatomy and purpose. Anatomy of the breast. Glandular tissue. Comprises the lobules and ducts. The lobules are clusters of milk-producing glands. Alveoli and ducts are passages that carry milk to the nipple. Nipple. The protruding area in the center of the breast from which milk is delivered during breastfeeding. It has small openings that lead to the milk ducts. Areola. The pigment area surrounding the nipple. The areola contains small glands, Montgomery glands, that secrete an oily fluid to lubricate and protect the nipple during breastfeeding. Fatty tissue. This surrounds the glandular tissue and gives the breast its size and shape. The amount of fatty tissue varies greatly among individuals. Connective tissue. Composed of ligaments and other supportive tissues. Cooper's ligaments help to maintain the shape and position of the breast. Functions of the breasts. Lactation. The primary function of breasts is to produce and deliver milk to infants. In response to hormonal signals, primarily prolactin, the glandular tissue produces milk, which is then ejected through the ducts during breastfeeding, stimulated by the baby's suckling. Sexual arousal. Breasts play a role in sexual attraction and arousal in many cultures. The clitoris and areola have a high concentration of nerve endings, which can enhance sexual pleasure. Hormonal production. Breasts also respond to hormonal changes, particularly during the menstrual cycle, pregnancy, and breastfeeding, influencing their size, sensitivity, and overall condition, immune function. Breast milk contains antibodies and other substances that help bolster an infant's immune system, providing essential protection during early life. Additional considerations. Breast health. Regular self-exams and screenings, like mammograms, are essential for early detection of potential issues, such as breast cancer. Changes across life stages. Breasts undergo various changes in size and shape due to hormonal fluctuations during puberty, menstrual cycles, pregnancy, and aging. Thank you for watching. We would love to hear your thoughts on narcotic plants in the comments below. If you're interested in learning more about medicinal plants and their applications, be sure to check out my other videos. Please like, share and subscribe. Stay healthy and see you next time.